Good evening. I'm Al Lewis of the Colorado Springs Community Action Coalition. Our coalition is made of members of the various African-American fraternities and sororities in Colorado Springs. We formed in August 2020 with the goal to provide as much information, education, and assistance as possible on major events and issues that affects Colorado Springs citizens, with a concentration on the African-American community. Our first venture was to inform and insist on voter registration, plus early and mail-in voting and casting ballots at the polls. We are strictly a nonpartisan organization. That is, we did not advocate for or against any politician, any party, or any issue. As you all know, COVID-19 is a very serious issue, and amongst the African-American community, there is a huge hesitancy to take the vaccine. The purpose of our panel today is to inform you and give you enough valid, verified information to persuade you to take the vaccine. Our information is coming strictly from state, local, and national authorities, but our local authority we use is El Paso County Health. And we have quite a few people left in the waiting room. I'm gonna let them in. And before we do that, after we do that, I'm going to introduce the panel members. Our panel members will attempt to answer as many frequently asked questions as possible during their individual presentations. I will send through the chat an email address for you to send additional questions. Please do not send questions through the chat, because the chat will not be monitored during this Zoom. At the conclusion, we'll have a short Q&A period to address some of the questions we received that were not addressed during the presentation. Here's our distinguished panel of local medical professionals in alphabetical order. Each will provide specific details, but also personal information they will share on how COVID-19 has affected either their lives, friends, co-workers, and families. I need to caveat the discussions beforehand. The one certainty about COVID is change. In some cases, change can be within the same day. All information presented today is factual and valid as of today. It may change tomorrow. But again, let me state, the information we're giving you today is factual and valid information. So first we have Dr. Crystal Angelique Davis Pepe. Dr. Pepe is a family medicine physician with Mountain View Medical Group. Dr. Pepe graduated cum laude with honors from the University of Arizona with a Bachelor of Science degree in molecular and cellular biology and a minor in French language. She studied at Tufts University School of Medicine in Boston and trained in family medicine at St. Joseph's Hospital and Medical Center in Phoenix. Next is Dr. Denard Ellison, an otolaryngologist at St. Louis Valley Health Systems in Alamosa, specializing in ear, nose, and throat, plus head and neck. He completed a degree in biology from Dartmouth College and his medical degree at the University of Florida College of Medicine. He received his specialty training at Martin Luther King Charles Drew University in Los Angeles. Okay, my hesitations, I'm going back and forth to let people in the waiting room. We also have Dr. Robin Johnson, the medical director for El Paso County Public Health and she serves as adjunct faculty for the UC Health School of Medicine. She received her doctorate in medicine from the University of Colorado and completed an emergency medicine residency with Denver affiliated residency. She also holds a certificate of medical ethics from Catholic Health Initiatives and a master's of public health from George Washington University. Dr. Marvin Lee is a board-certified internal medicine physician. Dr. Lee attended college at Brown University, where he studied biomedical engineering. He earned his medical degree at Morehouse School of Medicine in Atlanta and completed residency in internal medicine in Memphis. He also completed a master's degree in business administration from IE Business School in Madrid, Spain. Dr. Lee and his wife, Dr. Kenya Lee, are founders of the Purely Redefined Medical Spa. Dr. Taman Osborne Roberts completed his Bachelor of Arts in English and Biology at Williams College. He completed his medical degree at the University of Colorado School of Medicine. He serves as a team lead physician at Iora Primary Care in Denver and maintains academic appointments as an assistant clinical professor of family medicine for the Department of Health Systems, Management and Policy of the Colorado School of Public Health, University of Colorado School of Medicine, and as a clinical assistant professor in the Department of Health Systems, Management and Policy of the Colorado School of Public Health. Dr. Osborne Roberts is the founder and principal of Daybreak Healthcare. April Thomas is a family nurse practitioner with the Department of Veteran Affairs. She earned a Bachelor of Science degree from East Carolina University. She earned a Master of Science degree from Georgetown University, and she's currently pursuing a Doctorate of Nursing practice degree from Chamberlain University. As you've heard, we have a highly qualified panel, well-versed in a variety of medical subjects. They all have special experiences with COVID-19 that they will discuss. So we decided to put these discussions in blocks. And the first block of discussion is myths and misinformation. For various reasons, African Americans equate COVID-19 with previous trials and studies that did not go well with the African American participants. The main one that comes to mind is the Tuskegee Institute. Well, Dr. Lee is from Tuskegee. He'll discuss this and other COVID myths. So, ladies and gentlemen, Dr. Lee.
Hello, everyone. I'm honored to be included in this panel with such an accomplished group of healthcare providers and community leaders. As Al said, my name is Dr. Marvin Lee, and I own a medical aesthetic spa with my wife, Dr. Kenya Lee, in Colorado Springs called Purely Redefined. I'm an internal medicine doctor who's also served in the United States Air Force, and I did my active duty military service right here in Colorado Springs at the Air Force Academy. My experience with COVID has been primarily that of taking care of COVID patients in hospitals in Colorado, both in small rural communities in the western part of the state, but also right here in Colorado Springs and some in Denver. In that role, I have seen a lot of death and suffering. Families all over our state are coping with the unexpected loss of loved ones or adjusting to the needs of loved ones who have survived COVID but emerge unable to care for themselves. On a more personal note, my classmate at Morehouse School of Medicine, class of 1999, who was actually the person who organized my baby shower for my now 23-year-old daughter, died of COVID in 2020. Dr. Jermaine Cummings was an African-American family practice doctor in Metro Atlanta who dedicated her life to helping others and was a dear friend and respected colleague. I myself have been fortunate enough not to contract COVID, but my nephew and my brother both had COVID, and many of my own middle school and high school classmates have actually died of COVID, all from the African American community. My youngest brother, Daniel, actually participated in one of the COVID vaccine trials because he felt like he understood COVID's impact on our community and wanted to make a difference. Our community in particular rightfully has some reservations concerning accepting the COVID vaccine. And many of these reservations are based in the historical context of our experiences engaging healthcare in this country. Too often, our bodies have been misused and taken for granted in order to advance medical science, often with significant delays in realizing the benefits. As Al said, I am in a unique position to speak to a small part of that history. I was raised in the small town of Tuskegee, Alabama, where African American men with syphilis were told that they were being treated for bad blood, while in fact, they were not being treated, but were being studied in order to learn about the natural history of syphilis. The Tuskegee experience is one of many examples in our country's history of misuse of Black bodies. The famous Dr. Marion Sims, who pioneered many gynecologic surgical procedures, refined his techniques by performing unnecessary gynecologic surgeries on enslaved Black women without anesthesia and without their consent. Furthermore, there is a long history of eugenics in this country, which is the belief that people with certain genetic qualities are more desirable. This belief all too often has led to policies that allowed for the mistreatment of Black bodies, and is often the undercurrent driving some of the inequities we witness in our healthcare system. I am also in the not so unique position of being a Black doctor and therefore complicit, inheriting the professional legacy of this misuse of Black bodies, while at the same time coming from a community which has been marginalized and taken for granted. Navigating these grounds can sometimes be a beautiful struggle, a struggle that many of us on this panel know very well. Many of us on this panel are simultaneously standing on the shoulders of those whose bodies were mistreated, and also standing on the shoulders of those African American physician pioneers who contributed to science and medicine in great ways. Our community has a long and largely untold history of men and women contributing to medical knowledge and science in general. After all, it was an African American doctor who successfully performed the first open heart surgery. Another African American, Dr. Charles Drew, devised the system we use for collecting and storing blood in blood banks. I am here because I believe that this moment is unique in our country's history. The COVID-19 pandemic affects our communities disproportionately for reasons that my colleagues will bring to light. And we are in a unique position to reap the benefits of the COVID vaccine in a timely manner. I believe that this will have a tremendously positive impact on our community. I myself have also received both doses of the COVID vaccine. I made this decision to get the vaccine because I felt that it was the most effective way to protect myself, my family, and my community.
Okay, we often ask the question, just what is the vaccine? How did it evolve? Where is it today? And so Dr. Ellison is going to give us a brief history of the vaccine itself. And he has a few slides that I'm going to put up on the share screen for us. If you can go ahead.
Okay. Well, good afternoon, everyone. I thank you, Mr. Lewis, for inviting me to participate on this panel today. This is appropriate that we have a discussion on a topic that's very important to Black Americans throughout the nation. This is Black History Month, and it's so appropriate that we address vaccination hesitancy and how the evolution of the vaccine has come to us today. Over the past year, there have been 28 million United States Americans that have been affected with COVID-19. Over the past week, over 500,000 sadly have died. 6,000 have died in the state of Colorado. I'm hopeful today from the Federal Drug Administration that we will receive emergency use authorization for the third weapon against COVID-19, that being the J&J vaccine that would join the Pfizer and Mrna messenger RNA vaccines. But this is personal. It's likely both you and I know someone that has been deeply affected by COVID. I would like to show a picture of my family that currently live in Birmingham, Alabama. Like many other African-American families, they're multi-generation members of that family under one roof. Therefore, there's an increased risk of in-house transmission within a multi-generational family. It's likely 1 or 2 members with an underlying chronic disease may live in that house. We as African Americans have been disproportionately affected. When compared to our white counterparts, we're up to 2 times likely to be hospitalized or up to 2 times likely to die. My family in Birmingham, Alabama consists of my 88-year-old father, who has several underlying chronic medical conditions. He has diabetes, heart disease, and a chronic respiratory illness. He lives with my brother, Corey, my 2 nieces, Darren, Sydney, and my nephew, Devin. We understood the risk this particularly posed to my father. On December 25th of 2020, my father gathered with my brother and my nieces and nephew for a family picture. 4 days after that picture, my brother began to experience increasing difficulty to breathe and eventually a loss of sense of his smell. That prompted him to go get tested. And yes, he was positive. In those ensuing 4 days after that, both my nieces and nephew began to develop similar symptoms. We were quite concerned. I have a picture of my father 4 months before the onset of the pandemic, as he's resting in an emergency room, but he's gasping for air. We knew with his chronic underlying conditions, particularly his respiratory illness, should he develop COVID, he might likely die. In 2020, my brother followed all the public health initiatives as dictated by CDC. He actually went overboard. He was extremely vigilant. He would have ultraviolet wands throughout the house that would disinfect contact surfaces. He would strategically locate hand sanitizers at both the front and back of the home. And when appropriate in common living areas within the house, he would practice social distancing. Of course, he would mask up. Boy, did he mask up. Actually, when he actually went out into the public environment, he was actually wearing a respirator. That's how vigilant my brother was. But we were lucky. Both my nieces, nephew, and my brother recovered. 4 out of the 5 within the household had COVID. Fortunately, my father did not acquire COVID, but we were lucky. I don't want to depend on luck. I like to follow the science. I'm proud to say 5 days ago, my father received that second shot of the messenger RNA vaccine in his arm. December 2020 was important because that's when we were introduced to 2 potential saviors, the Mrna vaccine and the Pfizer vaccine. I admit I was skeptical. How can they roll out a vaccine in an 11-month period of time? Was safety sacrificed for speed? There was a lot of information, misinformation that was dispersed on social media. But I took it upon myself to do my own research. Let's pivot back to January 2020. Many of you, like I, in some far, far land that I never heard of, Wuhan, China, apparently a novel virus jumped from the bats to humans in some seafood market. And that was the beginning of the world pandemic. But what must be noted, within that 10-day period after the appearance of that severe acute respiratory COVID-2, the causative agent that causes COVID-19, we were able to identify genetically the sequence of this causative agent. That was very instrumental. The foundation of the science in which the development of messenger RNA had started 50 years prior to January 20th. It wasn't simply an 11-month process. By the fact that we were able to identify genetically that this virus was part of the coronavirus family, that we as scientists have been studying over 50 years in terms of the structure, the genetic makeup, and how it can affect both human and animals. Another important milestone came in 2002 and 2012. That's when we had the appearance of the predecessor of SARS-CoV-2, which was SARS, in the Middle Eastern respiratory virus in 2012. They were very genetically similar to the SARS-CoV-2. Much of the research and data collection that we performed on those two viruses was very instrumental in speeding up the process for messenger RNA vaccine. We understood studies that were performed in animals, and early clinical trials were done in a phase 1 style for both SARS and the Middle East respiratory virus. An important thing came out of that research. It confirmed that the spike protein S, which is on the outer coating of a coronavirus, was essential to cause infections in humans. And we also understood that spike protein may possibly be a target from which we can develop a vaccine candidate to combat COVID-19. Also, during the early 1990s, much research was done in cancer, particularly using messenger RNA platforms. Also, the information and data collected at the time was instrumental in enhancing and speeding up the process in which we have received the Mrna and Pfizer vaccines. I want to pivot to the time after January 2020. There were 3 significant events that also enhanced this process. We were in the middle of a worldwide pandemic. What was different, there was a much sharing of scientific information between medical research facilities and pharmaceutical companies throughout the world. Typically in vaccine production, you would have a trial and error process. This process was enhanced. At the time that we started to investigate potential candidates, there were greater than 150 different choices. If they would pass the grade of efficacy and safety, they would continue to go along this process. But if they did not pass safety or efficacy, they would be removed and replaced by another candidate. This trial and error process tremendously enhanced our production. A second point I'd like to discuss is Operation Warp Speed. That was particularly a cooperative agreement between the National Institute of Health and Mrna. What it did was remove many of the financial barriers and red tape typically we would see with vaccine production. Now I must note, the Federal Drug Administration is responsible for authorizing the use of any drugs or vaccines in the United States. At not any time did they abbreviate this process. They were looking for safety and efficacy. If they did not meet the grade, they were thrown out. The third most important point that I would like to talk about was the African-American representation in these clinical trials. Historically, we would have less than 5% participation in any drug or vaccine candidates. What happened was we needed to know how we as African-Americans are affected by a potential COVID vaccine. We have quite a bit of underlying chronic conditions and other social determinants that will end up, we will not respond as well or possibly respond as well to a vaccine. We needed to have participation. There were 70,000 participants in the phase 3 trials for Mrna and Pfizer. Nearly 6,000 of those were African Americans. This was led by leaders of historically Black universities and other national organizations that helped recruit the necessary participants we needed to have in a trial if we were going to trust a vaccine. If a trial had 99% composed of white Americans, why would we trust a vaccine to be given to us? It was essential that we had participation within the clinical trials. I'm glad to say the results were impressive. There was greater than 94 to 95% effectiveness across all racial ethnic groups. What was probably more impressive, I would cite the Mrna trial. Of those that received the vaccine, the first and second dose, not one African-American contracted COVID. Not one. 100% effectiveness. In the Pfizer trial, there were 11 individuals that received the first and second dose that did contract COVID. 10 of those were Caucasian. The one was listed as other. So I can't say it was 100% effectiveness in the Pfizer. That other was separated between Latino, African-American, and Native American. But nonetheless, the effectiveness of both of these vaccines was transformational. I personally received the second dose in my arm 6 weeks ago. I'm a personal testament on the safety of the vaccine. We're all concerned about the long-standing effects that the vaccine may have. What are the long side effects? The average time in this trial that these patients or trial members were evaluated was a 9-week period of time. Typically in the past, at 8 weeks, any significant long-term side effects would have been identified in the first 8 weeks. I'm an ear, nose, and throat physician. I spend up to 100 times a week asking my patients to remove their masks so that I can examine their nose and mouth. It's not uncommon they're sneezing or coughing, not 6 feet from me, but 6 inches from me. I have not gotten ill. I remain well. We're at a point now that we must follow the science. We must remember to wear a mask, practice social distancing, and wash our hands vigorously. We currently now have 3 options: Pfizer, Moderna, and a hopefully J&J vaccine, all of which are 100% effective, preventing you to be hospitalized or die. Thank you.
So here's what I believe the next presentation is going to address something. And it's really misinformation. And I think the biggest misinformation is a statement like this: I don't need the vaccine. I have never taken the flu shot. I've never had the flu. Well, right now, that is under the category of pure luck. Big, big, big mistake. Nurse Thomas and Dr. Osborne Roberts are here to talk to you about the block we call COVID and You. Please listen up. Nurse Thomas.
All right. Good evening, everyone. It is my pleasure to be a part of this panel today. As he mentioned, my name is April Thomas. I'm a family nurse practitioner, and I'm also a member of Iota Eta Chapter located in Colorado Springs of Chi Eta Phi Professional Nursing Organization, Incorporated. Being a healthcare provider, I'm at greater risk every day of exposure to COVID-19. Today, I plan to discuss my experience of having COVID-19, the symptoms I developed, and the process of obtaining the vaccine, along with the side effects I encountered after receiving the vaccine. Now, keep in mind, individuals may react differently to COVID as well as to COVID-19. I first noticed symptoms of COVID-19 on November 11th. I experienced body fatigue, stiffness in my neck, headaches, and dizziness. I already have a history of migraines. However, this headache in which I experienced was completely different from my normal. It was not your typical migraine or headache. This headache from COVID was a constant throbbing, dull, aching sensation that was located in the front and the back of my head and went all the way down into my neck. I have a 1-year-old, and he had an elevated temperature and was experiencing vomiting, nasal congestion, as well as a cough. So at this point, I decided it's time to go to the emergency room and be checked out. Upon check-in, we were both tested, and I received my results within an hour. Depending on where you are tested at, results are available within 1 to 72 hours. Thank God my son tested negative. However, I tested positive. And I have 2 other children as well that at the time were not displaying any symptoms. I immediately was told to quarantine for my children, and my spouse at the time was on a military mission and had to be called back from the field to take care of our children. During my time of quarantine, my symptoms worsened, and I developed a cough along with worsened headaches, fatigue, drowsiness, and then eventually, after 5 days, I lost my sense of taste and smell. I did not have any shortness of breath, and I did not require any oxygen therapy or hospitalization. During my visit at the ER, I was tested for the flu as well as COVID. I received IV fluids for hydration, pain medication for my headache and my body aches. There is not a cure for this virus. There are only medications to help the symptoms and to help you feel more comfortable. Depending on the severity of your symptoms, there are more medications being used to help with the treatment of the virus. However, individuals with mild symptoms are able to self-treat at home. I completed a 10-day quarantine in which I had to be away from my family and my friends. I also experienced a residual cough and headache for about a month. Currently, I have not experienced any long-term effects from COVID. Being a healthcare provider, I made sure I took all necessary precautions to prevent exposure, such as washing my hands, wearing a mask, maintaining 6 feet social distancing, as well as disinfecting my surfaces. However, I still ended up catching the virus. I constantly thought to myself, how did this happen? Even though I used all the necessary precautions to prevent from contracting COVID and spreading the virus, this proves that even though we may think we are doing the right thing, there is still room for error. I myself have lost several family members due to COVID. I chose to get vaccinated to protect myself, my family, as well as the patients in which I provide care for on a daily basis. By taking action and getting vaccinated, this will help to prevent the spread of the virus. After you receive your appointment for your vaccination, you will arrive at the location with your ID card. You will then be scheduled for your second vaccine and receive your COVID-19 proof of immunization card. You will then proceed to get your vaccine and be provided a fact sheet about the vaccine as well as side effects that you may have. And you will also be given a number to call if you experience side effects to report the side effects in which you have. After receiving your vaccine, you will proceed to a waiting area for direct observation for 15 minutes to monitor for adverse reaction. Please don't worry, a medical provider is on site for emergencies. If no adverse effects, you will be able to leave, and then you will return for your next dose as scheduled. After I received my first vaccine, I experienced soreness in my arm, fatigue, and headaches once again for 1 day. My second vaccine, I did not have any side effects at all. I hope by sharing my personal experience, I have answered most of your questions in regards to having COVID and obtaining the vaccination. The side effects associated with the vaccine outweighs the risk of severe illness and possible death. So it's highly recommended to get vaccinated to protect yourself, your family, as well as your community. Thank you.
So let's begin with what I'm going to say with a little introduction. My name is Mrna Roberts. I'm a family physician here in Denver, Colorado. I work primarily with older adults and have worked the majority of my career taking care of communities, including our own community, that have had some challenges. Let's start with a little bit of honesty from my part. This is hard. Everything over the last year has been hard. Frankly, being a person of African ancestry here in the United States is hard. Which is why, in my opinion, so much of what is going on with COVID-19 seems unfair. Why is it, once again, our community that is at higher risk? Why is this being pushed towards us? Why does it seem like we are the people getting this, and unfortunately, the people passing on from it? Why us yet again? And I'd like to just validate that. It is hard.
It's really difficult. But that doesn't change the reality that it is us getting it, and it is us dying from it, and that there are very, very specific reasons for that. One of those reasons, very simply put, is stress. Being Black in America is stressful. Being Black in America over the past few years in particular has been stressful. And there has been much written for a very long time about how stress affects the immune system and breaks it down and makes it less able to fight diseases like COVID-19. Truthfully, I probably don't have to tell most of you that. Most of you can probably feel that in your bodies on a day-to-day basis throughout the majority of the years you've had. But this is one reason why our community is more vulnerable. We're also at higher risk secondary due to our nutrition. Many times, many of us live in places where we don't have access to the same healthful foods that many others in our country have. Even if we do, oftentimes we have a harder time accessing that for a whole range of reasons. That leads to another reason that we're oftentimes more susceptible, which is oftentimes caused by nutrition, diabetes. Our community simply has a higher rate of diabetes. It's part due to nutrition. Frankly, it's also likely due to the stress that we've endured over the many, many years. And there are other potential reasons as well. But diabetes is something that makes COVID-19 more severe if you contract it, and makes those of us who happen to have it more likely to get it. And frankly, our entire existences, our jobs and our family lives oftentimes put us at higher risk. Many times the jobs that we have been called upon to do take us out into close communion with other members of the community. And that is the nature of many of the jobs that many of us hold. And truthfully, communion with other members of our community is incredibly important to us, oftentimes from a cultural standpoint. We live together, we work together, we get together outside of work, we get together at church and at each other's homes and for meals. This has long been one of the ways we have endured and survived and occasionally thrived. It's one of the things we've learned over time, but all of that puts us at higher risk. Now, having said all of that, I realize that there are some people listening to this talk right now, even at the end of everything I've said, who are still asking themselves, do I really have to do this? Like Mr. Lewis said, maybe you haven't been sick before. Maybe you really just don't see the point, or maybe you're just fed up. This is yet another thing that you really, really are just tired. And again, it just seems unfair. Well, let me tell you a little bit about my own experience. At the beginning of March in 2020, very early on, right as we were realizing this was a pandemic, I came down with COVID-19. And after having it, and having it for 3 or 4 days and really starting to get better, as a healthy 43-year-old physician, I thought, okay, that wasn't so bad. That was until I went to cook bacon on morning 4 or 5. And having thought, oh, I didn't turn on the oven, must not be cooking, I went out to find the bacon completely cooked and myself completely unable to smell it. And after taking a bite, to taste it. No taste for coffee, no taste for chocolate. Honestly, if I'm being honest, couldn't even taste whiskey. It's frightening. That went on for 2 months, and I did not know if I'd get my sense of taste or smell back. But over time, it did start coming back, and I thought, okay, I might be done. But that was until the fatigue started. And I found myself unable to engage in physical activities that brought me joy, and things that I had been able to do pretty easily just a couple of months before. And as that was going on, I began to develop digestive difficulties, where I tried to swallow and I could feel the food stick right here. Half a minute, wouldn't go down. I'd swallow some water, try to get it to go down, still wouldn't go down. And eventually it would clear, but it left me wondering with every single meal, is this the time that my stomach finally stops working? 8 months after contracting COVID-19, the long haul symptoms that I was having finally cleared. 3 months, actually not even 3 months, 1 month after that, I had my first COVID-19 vaccination and my second vaccination a month after that. And I will tell you, between having had COVID-19 and the symptoms that it came with, and the mild flu-like symptoms I got after each of my COVID-19 vaccinations, hands down, no question, I would take the COVID-19 vaccination again over having had COVID-19. Thanks for listening.
Okay, so you heard live by medical doctors, medical nurses, people in the medical profession that have caught the virus, that have been infected by the virus. And you would think all the precautions that they're taking and all the things that they've talked about to prevent, and they still come up with the virus. So now Dr. Pepe, she's going to give us some specifics about the vaccine. In her presentation, she will answer some very frequently asked questions, and she'll bring up something maybe some of us have never even thought about. Dr. Pepe.
Good evening, Mr. Lewis. Good evening, colleagues. Good evening to all of you joining us. Thank you for coming. In addition to being a family medicine doctor at Mountain View Medical Group at Centennial, I am also a daughter, and here are my parents. These are my parents. They're in their early 60s, and here they are on Christmas Day 2020, visiting with my sister-in-law, who is confined to her home because she has contracted COVID-19. She is an ER nurse in Scottsdale, Arizona, and thankfully, she did not develop severe illness. You can see her here in the window, and my parents here outside. She was able to return to work after a few weeks of rest at home. Thankfully, and miraculously, my brother, her husband, did not become infected with COVID-19. They stayed in separate parts of their home, my brother delivering food and drink to her door. The two opened their Christmas gifts together in their living room, each wearing N95 masks. COVID-19 touched my family at the end of 2020, and I pray that no more of us fall ill. Here is where the COVID-19 mRNA vaccine comes into the picture. Here is where you come into the picture. In my segment of this webinar, I'll be discussing the vaccine and you. Dr. Ellison explained the development of the vaccine, and I will share how the COVID-19 mRNA vaccine works in your body. The COVID vaccine uses a code of instructions called messenger RNA. This messenger RNA allows our bodies to make a small, harmless piece of the coronavirus called the spike protein. Once our own cells make this spike protein, our immune system, which fights off infections, recognizes the protein as foreign and begins to create ways to fight it. One way is by producing antibodies, which attach to the spike protein and mark it for destruction by other parts of our immune system. In addition to making antibodies, our immune system also has white blood cells that destroy infected cells showing the spike protein. After getting vaccinated with the mRNA vaccine, our bodies have two effective ways of getting rid of COVID-19 particles before they have a chance to make us sick. As for the mRNA given in the injection, our cells break it down after a few days. Here are a couple of analogies. mRNA is like a recipe or instruction manual. It is a recipe for an outer part of the virus, the spike protein. It is an instruction manual for building the spike protein. Think of the last time you put something brand new together, like a piece of furniture or a toy. It can take a while to get the hang of it. If you made two of the same things, did you notice it took less time to make the second one? Stimulating our immune system can be like this process. The first time we are exposed to something, it takes some time to get a grip on it. The next time we are exposed to that same thing, our bodies are familiar with how to tackle it. The two-dose nature of our current COVID-19 vaccines helps our bodies build confidence in its ability to recognize and combat the virus. Here are some facts. The mRNA vaccine cannot give you COVID-19 because it does not contain live virus. The vaccine does not affect or interact with our own DNA. Our DNA lives in the nucleus of our cells, and the mRNA in the vaccine does not enter the nucleus. Any discomfort you experience after your vaccination is temporary and a natural part of the process, a sign that your immune system is working. Another vaccine is coming down the pipeline, the Johnson & Johnson vaccine. This one is called a viral vector vaccine, and it works by using a changed version of a different, harmless virus to deliver a piece of the spike protein. The viral vector, that harmless virus, uses our own cell's machinery to make the spike protein, which is then shown on the surface of our cells and starts an immune process similar to that of the mRNA vaccines. It only takes one shot and is effective after 28 days. The Mrna vaccine has been approved for emergency use in people 18 years and up, the Pfizer for people 16 years and up. Neither mRNA vaccine contains eggs, preservatives, or latex. Both are safe for people with high-risk conditions like obesity, heart, lung, or liver disease, diabetes, or HIV. For the mothers in the audience, I too am a mom to two adorable children. Granted, I am biased on the adorable part. As moms, we try to protect our children in every way that we can. Getting vaccinated is one more way that we can do that, while protecting ourselves as well. If you are pregnant or trying to become pregnant, the vaccine is something that can help you stay safe. Pregnant women in general are more vulnerable to viral infections due to changes in the immune system during pregnancy. Based on what we know at this time, pregnant women who are infected with COVID-19 are at increased risk for severe illness, needing to be hospitalized, admitted to the ICU, placed on a ventilator, and even increased risk of dying from the infection compared to non-pregnant women of the same age group. Additionally, pregnant women who get infected with COVID-19 may be more likely to have premature babies. While we don't have human studies to provide more data on the vaccine and pregnancy, studies in rats who received the Mrna vaccine before or during pregnancy did not show any safety concerns. Getting vaccinated while pregnant is a very personal choice. You should know that there are many benefits to vaccination and many risks to COVID-19 infection during pregnancy. For those of you who already have your precious little ones in your arms and are breastfeeding or nursing, we don't believe that breast milk is likely to spread the virus to your baby, and mRNA vaccines are not thought to be a risk to the breastfeeding baby. If anything, antibodies from vaccination can pass in the milk and offer some protection to your baby. You may have questions about the vaccine and your fertility or ability to have children. There is no evidence that the COVID-19 vaccines cause infertility. There have been pregnancies in the female study participants in the vaccine group of both Pfizer and Mrna trials. Some of you may have concerns about the vaccine and fetal stem cells. The mRNA vaccines do not contain fetal cells. However, both Pfizer and Mrna used fetal cell lines to perform tests to confirm that the vaccines were effective. Fetal cell lines are not the same as fetal tissue. So who should get vaccinated? Everyone, 16 to 18 years and older, depending on the vaccine that is available to you. Even if you have a history of severe allergic reactions to something other than vaccines or injectable medications, and even if you have a family history of severe reactions or allergies to oral medications. Who should not get vaccinated? If you have had a severe allergic reaction or an immediate allergic reaction, such as hives, swelling, or wheezing, within 4 hours of exposure to any ingredient in an mRNA vaccine, you should not get it. The key ingredients that can trigger such reactions are polyethylene glycol and polysorbate. If you have had if you've had a severe allergic reaction or an immediate allergic reaction after getting the first dose of the vaccine, you should not get another dose. I hope that I have provided you with some helpful information about the COVID-19 vaccines and you. With that, I'll pass the baton back to you, Mr. Lewis.
Okay, all right, and our final is Dr. Robin Johnson. And she's here to answer what I believe is the most important question is, how do I get vaccinated? And she'll discuss supply and demand and also provide some of the differences between the two, Pfizer, Moderna, and the newly approved J&J. And she will give you a very huge listen up, and a very huge foot stomper. Dr. Johnson.
Thank you, Mr. Lewis. I am really honored to be here tonight and to join you in this conversation. It is something that I have been really passionate about. As an emergency physician for 24 years, I've seen many of the things that arise in our communities, from health and social risks. The ED is truly a litmus test of what's happening in culture. And these experiences moved me to advocacy in healthcare, really addressing emerging issues and really striving to find ways for access to care at the right time and the right place. Since December of 2019, we began tracking this virus as it emerged in Wuhan, and then we began seeing our first cases in March. And I have to say, it's consumed much of my time and energy over the last year. Not only for me personally as the medical director, as we've been trying to learn about a novel virus, learn how we can protect our community and educate our community, but also in my family. I have a daughter who's a nursing student, has been serving as a CNA on the COVID wards, and my husband, who's an ICU physician. So daily, they have been walking into the front lines in the battle against this virus. And then my colleagues, as emergency physicians and surgeons, intensive care docs, have been on that front line. So probably one of the most profound days for me in this past year was early December, when we saw the first vaccines come forward into Colorado Springs. And it was one of my emergency physician friends who actually stepped up and took that first vaccine. It was a moment of excitement, celebration, joy that we had light at the end of the tunnel, that there was hope beyond just some of the messages that I feel like are on auto after the last year, to wear our masks, to maintain our social distance, to wash our hands, and recognizing that for us as a human and as a community and culture, that we need so much more than that for full human flourishing. And so here's an opportunity for us to add one of the most powerful tools of public health preventive measures into that layered approach. And as we layer on our vaccine and reach herd immunity, meaning enough people to really break that transmission of virus, that we'll be able to begin lifting some of these other measures, reconnect our economy, reconnect our social structures, reconnect ourselves to our loved ones and friends. So as we look at how we were going to distribute this, we realized early on that this was a very limited and precious commodity. It was distributed to us in limited supplies, which are increasing over time. We developed within our community a vaccine consortium, those phase 1 providers who will have access to these vaccines, and really came together jointly with a dedication to get every vaccine that is provided to us into arms of our residents in a timely and safe manner, while treating everyone with dignity, respect, and equity. We realize that one size doesn't fit all, and so we've developed a 3-pronged approach. And the first is just that day-to-day vaccine effort, and it's the brick and mortar, as I call it. Our vaccine providers have their sites, they have their facilities, and they can capitalize on those resources that they already have in hand to begin daily getting out those vaccines. And so we know that Matthews VU and Peak Vista can get out 500 to 700 vaccines a day, where UC Health at their MAC building can do up to 2,000 in a day. So we're beginning to get that supply out as it becomes available. But beyond that, we knew that we needed to be able to reduce barriers, whether it's language or transportation or accessibility. And so we began to develop those pop-up clinics that would go into some of the geographic areas or utilizing non-traditional sites in which people might be more comfortable getting a vaccine rather than coming to a clinic. And so we've had some at our Fountain site down for public health, but also at YMCA, and are looking at utilizing some of our leaders that are trusted throughout the community to set them up in churches and some other avenues. And so it is important to be listening for some of those opportunities that may come not only geographically, but also into some of those sites that just are more comfortable in which to receive the vaccine. Also, there are the third prong, which is that max vaccine event. And I say that these are kind of the sexy events that create more enthusiasm and knowledge, and just the understanding and voice out into the public that the vaccine is available. And in seeing this many people, line up and get vaccinated, it encourages others to really consider getting that vaccine. So our phase 1 providers have been the hospital systems, Centura, St. Francis, and Penrose, Children's Hospital, as well as UC Health Memorial. We have Matthews VU, Optum Health, Peak Vista Community Health Center as our federally qualified health center, Kaiser, and our pharmacies have joined in. CVS, King Soopers, Safeway, Walgreens, and Walmart are all at the table as we look at ways to get this vaccine out. Because of the mRNA being a more fragile vaccine, it has to be handled in really cold, super cold storage. It has a short half-life once it is thawed. It's really important that we had very dedicated providers as we moved initially forward. It's important for you to understand where your resources are for information and vaccine distribution. And honestly, we have hopefully promoted this from the very beginning of the vaccine, to know your resources, that they're trusted, as Mr. Lewis stated, that they're science-based, and that you can assure that they are laying to rest any of the myths. Public Health has information on their website at elpasocountyhealth.org, not only about the vaccine, but also who is offering it at this time and how you can connect with those providers, whether it be through the internet and their web connection or a phone number to call. It also gives information about the vaccine and potential myths, as well as facts that you may want to know and further information. The other reliable source in El Paso County for getting vaccine is through the 211 line, and there are people there that can answer your questions. And for those 70 and older, we are really pushing to finish that phase of our vaccine distribution. And so there will be a hotline that is set up that will be just for individuals who have already enrolled but have yet to receive their vaccine, so that we can assure that those numbers and names are connected with the providers, and we keep you at the front of that line and get you vaccinated, knowing that there are individuals higher risk, and that phased approach has been placed to try to reach those who are at the highest risk of either contracting the disease as a frontline worker and then spreading it, or in contracting it, having a severe disease or fatality. So those are some of the ways that we are moving forward. We're doing also an Operation House Call for individuals who may be homebound because of illness or other reason, and that is being done through the fire department, coming along in collaboration with our Medical Reserve Corps to actually take the virus out into the home. It takes a long time. They can only get about 6 vaccines per team in a day because of travel and all of the other things that are needed to take care of the patients that they're connecting with, and taking care that the vaccine is appropriately distributed. But it is an exciting new avenue that we're getting the virus out the vaccine out that started just this last Wednesday. So I wanted to end by speaking to a little bit about these vaccines, and Dr. Ellison and Dr. Pepe both touched on this, but both Moderna and Pfizer have about 94 to 95% efficacy, meaning that they prevent disease with any symptoms that 95% of the time. We are not completely sure of asymptomatic infection in the data or asymptomatic spread once you've had the vaccine. So that's why it's still imperative that we continue all those other preventive measures, wearing your mask, keeping social distancing, really washing your hands until we reach herd immunity. No tests were done on the mRNA vaccines on a one-dose option, though those are underway with these two vaccines. J&J is coming forward, and we are anticipating that it will be available within the next week or two here in Colorado. It is 66% effective in preventing all symptomatic disease, but 85% in preventing severe disease or hospitalization, and 100% effective in preventing fatality. There's no significant differences in the safety profiles of any of the vaccines. So there are trade-offs around the one shot to some decrease in efficacy. And they are looking at Johnson & Johnson, a two-shot series to see if they can reach the higher efficacy of Moderna and Pfizer. But the bottom line is that we need to get vaccinated when it is our turn, because it protects you, it protects your family and friends, and it leads us as a community towards that herd immunity that will allow us for more robust human flourishing, to reconnect our economy, our social, and our personal connections. So the supply chain is going to take a while to increase to meet demand. And so at this point, the most important thing is to get your vaccine when offered and get protected. So I want to again just thank you for the opportunity to be here, and I'm going to turn it back to you, Mr. Lewis, so that we can begin to entertain questions.
Oh, okay, all righty. Well, we did a real quick and fast. What is the vaccine? The myths of the vaccine, the evolution, how it affects you, how the coronavirus affects you, how the vaccine affects you, where you could get the vaccine, and the efficacy of the vaccines, and the overarching message that you should have gotten out of the medical doctors is easy. Get the vaccine. Get it when it's your turn to get it. Don't sit there and say, I'm going to wait on another one or something like that. As Dr. Johnson stated, they're effective. And as Dr. Osborne stated, it's better to have the vaccine and have a little bit of pain maybe from that versus not having a vaccine and have from 8 months to death from not having it. So the questions that came in, hopefully we can answer them within about 10 or 15 minutes of time we have left. First question, how long am I protected after taking all required shots? Can I still become infected? Dr. Johnson, would you take that one?
Sure. So that's actually a really good question that we are continuing to monitor. So once a vaccine finishes phase 3 trials, it moves into being dispensed to the public, and we call that the phase 4 trial. We continue to gather data on all of the vaccines throughout the life of the vaccine as long as it's being utilized. So while we talk about efficacy, so with the mRNA, the Moderna or the Pfizer, there's about 5 to 6% of the time that you could still get an infection and be symptomatic. But of those, we haven't seen hospitalization and death with those infections. And the one thing we don't know, though, is how often you may be asymptomatic and still have the virus. The assumption from previous knowledge is that we will not be as infective even if we contract it after our vaccine. And that is part of the the reason the vaccine can break that chain of, challenging passing from one person to the next. And so we are anticipating that you will not, even if you were to get the infection, it won't be one that you could pass on. It probably will not have any symptoms with it. As far as we know, the anticipation is anywhere from 1 to 3 years that you will be immune. And there may be a required booster that you would get at that point. Again, we are gathering that data to know for sure exactly how long it will last. But that is what is anticipated at this point, is that 1 to 3 years.
Okay, next question. If I've already had the virus, I hear one of the vaccines, I hear just one of the vaccines, of those vaccines that require 2 shots is good enough. Is that true? Let's see, Dr. Osborne Roberts, would you handle that one?
Absolutely. So the recommendation currently is that if you've already had the virus, you should go through a full course of whichever vaccine you obtain. For Pfizer and for Mrna, that's a 2-shot series, both of them. For the Johnson & Johnson vaccine that looks to soon be approved, that will be 1 shot. Now, if you have had the virus, it is permissible to wait for 90 days after your recovery before having a vaccination. That's not a requirement. It's not something that the CDC is being very strict on in terms of saying you must wait 90 days after having recovered from COVID-19. But given that there is some evidence that you maintain antibodies for at least that long after having had the virus, you can wait for 90 days, 3 months before getting your vaccination. At the same time, if you'd like to get it inside of that time period, that's allowed, that appears to be safe, and would be advisable, especially if you can't get it later.
Okay. If one has not had symptoms, could they still have had a mild case? Can you know if you might have contracted but no symptoms? After having vaccine, can one still contract? Dr. Lee?
Thank you, Mr. Lewis. So that's a great question as well. Definitely, you can have COVID-19 infection and not show symptoms, which is why it's important that we're diligent about mask wearing and social distancing and washing hands and all those public health measures that really do make a difference. Sorry. Do you mind repeating the question?
Okay. Okay. If one has not had symptoms, could they still have a mild case? Can you know if you might have contracted but no symptoms? After having vaccine, can one still contract?
Right. So, and it was the second part of the question that I wanted. So, there's not a sure way to know if you have had it without symptoms, without having antibody testing. I think in terms of that affecting your decision to get the vaccine or not, I feel like we should still get it, even if you have that suspicion. I'm assuming that a person that has that suspicion has maybe been exposed to someone with COVID, but you certainly can have asymptomatic infection, particularly that younger, healthier population. I think they're more likely to be asymptomatic, but I think it is really important that they get vaccinated as well. And in many ways, it's actually more important because they're more mobile. They interact with multiple generations, and are often, at least in the folks I see with severe COVID in the hospital, older folks have typically gotten the infection from their kids or their grandkids. So I think it's a really important question, but I think it probably should not affect your decision to get the vaccine.
Okay, and one more question, and this is for Dr. Pepe. What is mRNA, and is this a delivery system? If so, are there other ways to deliver? Why this? I've heard that this is not really a vaccine.
That's a wonderful question. So mRNA is part of a genetic sequence. And what it does is that sequence then gets changed into a protein, which is something that our body can recognize and use. In terms of the vaccine itself contains this genetic code, and it's encoded or covered in some lipids, which is like a fat particle to protect it. And then that's how it gets into our cells. So it truly is a vaccine, but it's a different way of delivering a vaccine, as Dr. Ellison talked about earlier this evening. But it's definitely some new technology, and probably we'll see a lot more vaccines coming around this way because we can sequence the virus that's causing illness and then find a way to protect ourselves from it.
Okay, so again, I want to thank our medical panel of Dr. Marvin Lee, Dr. Crystal Pepe, Ms. April Thomas, Dr. Denard Ellison, and Dr. Robin Johnson, and Dr. Taman K. Osborne Roberts. But I want to thank you for dialing into this webinar, and we hope you've received enough information. If you have not already received your vaccination, that will convince you to receive it. But most important, we hope we've given you enough information where you can go and convince someone else, especially those doubters, to go and get their vaccination. It's sort of like washing a window from the bottom up. If the whole United States is trying to overcome, mitigate this catastrophe, but however, you have a segment of the population that's not joining in, we're spinning our wheels in the sand. So hopefully you can convince those doubters about that, give them as much education as possible. If you have any further questions, you can still send a question to that email address I gave you, and we'll get that back to you as quick as possible. So again, thank you very much for joining us, and please have a wonderful night.